o'clock. How are you? Welcome. Welcome to today's news briefing, the second in a series of video conferences hosted by LA County's COVID-19 Joint Information Center for Ethnic and Community Media. I'm Pilar Marrero, Associate Editor of Ethnic Media Services. On behalf of our ethnic media outlets, my thanks once again to the Joint Information Center's team for coordinating this valuable service to help us track the county's response to the COVID-19 pandemic and the services the county is providing to ensure the well-being of all LA residents. Today, we are delighted to welcome back Dr. Eloisa Gonzalez, Director of Integrative Medicine, the Wellness Center at LAC USC Historic General Hospital, for another update on the pandemic in LA County. Dr. Gonzalez has agreed to lead off each of our briefings with her updates. Thank you, Dr. Gonzalez. Then we will turn to the topic of food insecurity in LA County caused by the economic shocks from the pandemic. Food insecurity refers to disruptions in food access and regular eating because of limited money or other resources. As you will hear from our speakers, nearly 1 million households suffered immediately from hunger-related issues at the outset of the pandemic. Altogether, 1 in 3 county residents experienced food insecurity in 2020. We are so honored to have these 3 speakers: Gary Gero, who directs the county's Emergency Food Security Branch; Abraham Gomez, CalFresh Program Manager at the Department of Public Social Services; and Elizabeth Cervantes, Director of Agency Relations and Product Acquisitions for the Los Angeles Regional Food Bank. After the call, we will email a who's who of our panel and a video of the conference, along with any collateral provided by the speakers. So we ask reporters to enter your questions in the chat box. We will take 2 to 3 questions after each speaker, with more time at the end of the conference call for additional questions. And without further ado, we go to our first speaker, Dr. Eloisa Gonzalez, Director of Integrative Medicine at the Wellness Center at LAC USC Historic General Hospital. She is also the Department of Public Health spokesperson for Spanish media on the COVID-19 vaccine. Dr. Gonzalez, thank you so much for being with us.
My pleasure. Thank you, Pilar. And thank you to all of the media outlets for joining us for today's briefing. I'll be providing updates on our current status of COVID-19 cases and information on the new sectors eligible for the COVID-19 vaccine. May I have the first slide, please? Thank you. We continue to make progress in reducing the average number of daily new cases of COVID-19, though our numbers remain elevated. The 7-day average number of daily cases peaked on January 8th with more than 15,000 cases, and now has dropped by 90% to 1,600 a day. Since this number is average cases by episode date, meaning the date a person was tested or began having symptoms, it does not necessarily match the number of cases we report each day in our press release, which is daily reported cases that could have happened days, or in some cases, more than a week before they are reported to us. I want to thank everyone for making this decline in cases possible. This wasn't a miracle, and this significant drop in our case numbers reflects actions and choices taken by millions of residents, workers, and employers. We should continue to see, should we continue to see less cases, we can move forward in our recovery as lower case rates allow for other sector reopenings. Last week, the decline in the daily case rate allowed schools the option of reopening for in-class instruction for students in grades TK through 6. When the case rate drops to 7 new cases per 100,000, schools will have the option of allowing in-class instruction for students in grades 7 through 12. Next slide, please. There's been a lot in the news recently about variants of interest and variants of concern. Public Health and USC currently are investigating a cluster of 4 cases of COVID-19 at USC. Of the cases being investigated, 2 patients are confirmed to have the UK variant B.1.1.7, and 2 are suspected as variant cases, still awaiting laboratory confirmation. All cases were detected as part of USC's routine testing and surveillance program. These individuals are doing well and they're in isolation. Their close contacts have been identified, notified, and are quarantining. Scientific research suggests that the currently available COVID-19 vaccines are effective against the UK variant. But with vaccine supplies still limited, the local transmission of the potentially more infectious UK variant underscores the need for Los Angeles County residents to continue to use every tool we have to prevent transmission, including not gathering with people you do not live with, and distancing and masking when you are out of your home and around others. There are now 18 confirmed cases of the UK variant in LA County. To date, we have not yet found any cases with the South African variant in LA County. A news story this week mentioned that researchers at UC San Francisco identified a California variant that is widely circulating and believed to be more infectious and virulent. While we have not seen any of their research documents, we can confirm that between 40 and 50% of samples sequenced in our public health lab since December contain the L452R mutation of interest. Next slide, please. As we vaccinate our residents who are 65 and older, we have been noting a very similar and frightening pattern of inequity. As you can see on this table, white and Asian residents 65 and older continue to have the highest vaccination rate. As of February 20th, almost 48% of white residents and almost 45% of Asian residents 65 and older have received at least 1 dose of the vaccine. 38% of American Indian Alaska Native residents and 34% of Latin residents and 29% of Black residents who are age 65 and older have received at least 1 dose. And while these inequities are stark and unfair, when we look at the relative percent change from the week of February 9th to the week of February 20th, we see that we are making some progress improving vaccination rates in the hardest hit communities. The vaccination rate for Black residents saw the largest increase at almost 45%. For American Indian, Alaska Native residents, the vaccine rate increased 37.1%, and Latinx residents' vaccine rate increased by 31.9%, while the vaccine rate for white residents increased by 25.1%, and for Asian residents increased by 21.9%. Right now, the gaps in these rates represent inequitable access to vaccines. The shortage of supply has made appointments scarce and difficult to obtain, especially for people who may not have the time or technology to register. Improving access to areas of the county that have been hard hit is our priority. And these tend to be in areas where many Black and Latinx residents live. We have opened additional sites in these areas and are working with community groups who are assisting with registering people in these communities for vaccination. We're happy to see these early increases in vaccination rates as they indicate that our strategies may be working. And we thank our partners for their help and support as we continue to ensure easy access to vaccines in those communities that have borne the brunt of this pandemic. Next slide, please. Beginning on March 1st, eligibility for vaccinations in LA County opens up for food and agriculture workers, law enforcement and emergency responders, and education and childcare workers who live in LA County. All eligible workers will be able to sign up for appointments starting next week at the dozens and dozens of community vaccine providers, including pharmacies, health clinics, and City of LA vaccination sites listed on vaccinatelacounty.com and vacunatelosangeles.com. Healthcare workers and residents 65 and older remain eligible for vaccines and can continue to find appointments on vaccinatelacounty.com and vacunatelosangeles.com. Next slide, please. An estimated 470,000 people work in the food and agriculture sector here in Los Angeles County. For this sector, because it includes such a variety of occupations, one-size-fits-all approach will not be adequate. There are a number of food services and agriculture workers who may not be easily reached. Therefore, it will be necessary to not only partner with employers and employee organizations, but it will also require coordination with trusted sources for these groups like unions, workplace leaders, community leaders, and community-based organizations. Next slide, please. We estimate that about 691,000 people will be eligible for a vaccine in the education and childcare sector. Many school districts have partnerships and capacity to create their own pods to vaccinate their workforce. Independent and parochial schools will be partnering either with their school districts or will have reserved appointments at county pods for their workforce. There will also be opportunities for childcare workers to be vaccinated at closed pods and with reserved appointments at the county pods. Next slide, please. For the emergency services and first responder sectors, agencies, including the courts and correctional facilities, we will be partnering with fire departments, police departments, the Department of Public Health, the Department of Health Services, and local hospitals to vaccinate their workforce. We estimate that over 145,000 people work in this sector. So that's it for my slides. In closing, I want to acknowledge the remarkable work that is being done by our many partners to vaccinate people who are currently eligible. There are so many people working on this effort, from the vaccinators at the over 400 vaccination sites who every day are providing vaccines to thousands of people, to our many partners who are continually innovating to create ways for people who are living in the hardest hit areas to have access to the vaccine. There is no shortage of heroes here in LA County, and I could not be more grateful for all of this amazing work. Thank you, and back to you, Pilar.
Thank you very much, Dr. Gonzalez. Talking about supply, which is always the key question when we talk about the vaccines, can you talk a little bit about how that supply is determined and when do we expect it to improve?
Well, so it is very different depending on the sector, how many vaccine doses they are allotted. As we know that we're opening up to additional sectors starting on March 1st and potentially even more after that, supply still remains our rate limiting factor, if you will. So the allocations are made often by the state, and then we sort of implement them locally. In the case of schools, allocations are going to be made to each school district to be proportional to the number of staff, but also weighted for COVID-19 impact on the district, on provision of in-person education and on the percent of students that are receiving free and reduced price lunch, for example. So every sector takes slightly different areas of importance for that sector to determine the doses that are allocated. But until we have a much greater supply of vaccine, which we hope will increase, should the Johnson & Johnson vaccine be approved, we're going to continue to see this competition among all of the eligible residents to be able to compete for the few doses that are available.
So we're still talking about not having enough vaccines coming from both the federal government. I don't know, does it all come from the federal government, or California buys their own vaccines as well?
That's a great question. So we in LA County receive doses from a variety of different flows. However, ultimately, they come all from the federal government. Some come directly from the federal government to certain partners that have been identified and have agreements with the federal government to receive vaccine doses directly. Then there are ways that we get the state of California gets an allocation from the federal government, and then California disperses those across the state to the various different public health, to all the different counties. Usually it's the public health entities within those counties. But also the state, like the federal government, has direct sort of contracts, if you will, with specific partners. The state also has that within California. For example, they partner directly through an agreement with Kaiser, because Kaiser has approximately 25% of all the insured population, healthcare insured, are covered in California by Kaiser. So Kaiser has a direct source of doses that are provided by the state, which are separate from the doses that are provided to the county public health department, to us as a public health department. So the federal government has also established at least one federal vaccination site at one of our Cal State universities, and that also comes directly from the federal government. So ultimately, yes, all the doses come from the federal government, but some come directly and some come through the state.
A question in the chat, any expected time frame for the Johnson & Johnson vaccine to be available?
Thank you for that question. We do have a report that we've all seen, I think, the reports about the report saying that the Johnson & Johnson vaccine has been found by the FDA to be effective and safe. So now it's a matter of the FDA taking their official vote and making it known what the result is of their vote. We hope that will happen by sometime in the next 2 days.
Okay. And another question in the chat, for those seniors who had cancellations on scheduled second shot, and I know some of them, and they've been complaining on Facebook, any resolution in sight?
Well, first of all, my apologies to everyone who's had a cancellation. We at the LA County Department of Public Health have not done very many of those cancellations. I believe, or at least it's my understanding, that the majority of the cancellations were at sites that were administering the Moderna vaccine. Because of weather problems around the country, there was a delay in shipments of Moderna vaccine. In the county, our county operated sites primarily use the Pfizer vaccine. So we really didn't need to do much of any cancellations. For those individuals who are coming to a county pod at any point to receive a vaccine, should they become aware that their vaccine appointment has been canceled, they shouldn't worry. They should, all rest assured that their second dose is guaranteed. And if their second dose is the one that was canceled, all they should do is go 1 week later on the same day at the same time with their white card that shows that they were at that site, either 3 or 4 weeks ago for their first shot, and they will receive their second shot, even if they don't officially get a second rescheduled second dose appointment.
Okay, thank you for that explanation, Dr. Gonzalez. And we're going to move on to the second speaker now. And some questions remain in the chat, but we'll have more time later to ask them. So we're going next to Gary Jarrow. who directs the county's Emergency Food Security Branch. Mr. Darrow, please go ahead.
Thank you so much, and thank you for everyone being here and for your interest in this topic. It is so critical to the health of our community. Let me start by saying that, the county recognized immediately a year ago that this was not just a public health crisis, but it's truly an economic crisis as well. So many people have lost their jobs as a result of the pandemic. And we understand and know that it's economic insecurity that causes people to go hungry, that causes food insecurity. And so at the same time we were launching our efforts to address the virus itself and to protect people's health, we also launched our food security branch in our emergency operations center. And so I and all of our team are part of the county family that have taken on these new assignments and new responsibilities to respond to helping those in need. We have librarians and parks employees and pool lifeguards and all sorts of county employees that are out either at the vaccination sites or that are working in response to the public health crisis, and also working to help deliver food resources to those who need them. And my own story, if just to maybe digress for a second, is the county's chief sustainability officer, where I work on policies and programs to address public health and equity impacts of environmental pollution in our communities. But during a crisis such as this, we all in the county are jumping in to provide the support and help that is necessary to get us all through this. So when we launched the food security branch last year, we of course set out to respond with specific programs, and I'll talk about those in a second, but we also wanted to truly understand the nature and scope of food insecurity in Los Angeles County. And we partnered with USC to conduct research among the population. And what we discovered was shocking and astounding. 1 in 3 residents of LA County over the past year have struggled with food, getting adequate food resources. And there are 10 million people in the county, so that means 3 million people in this county over the past year have had times where they haven't had enough to eat or anything to eat, and that's tragic, of course. And we've worked very hard to address that, and I think we've made a dent. But this is a huge problem, of course. And some of that research also pointed out who, in particular, those 3 million people are, and we saw that Black and Latinx populations were much more affected than the general population. In fact, 40% of Latinx individuals were food insecure at some point over the last year. That's remarkable. And the other interesting fact that we discovered was that it's really young people, people ages 18 to 40, with children without a college degree, who are the most affected. And that I think makes sense if you think people who are in that category. A lot of them are gig workers or restaurant employees, food service workers, and so significant food insecurity among that population. So of course, the first thing we did was to say we have existing programs in the county that are meant to address food needs, and we have programs like CalFresh, which are essentially the food stamp program. And we have a speaker after me that'll talk more about how the CalFresh program expanded. But there's others, including the Women, Infant, Children Nutrition Program, which provides food support to pregnant women and mothers of young children. And given the statistics I just cited, I think it's critical that the WIC program, as it's known, be enhanced and promoted, and we've done that. And we've also, of course, had to respond with expansion of our senior meals programs and to provide home delivered meals. And we've provided over 4 million home delivered meals now to seniors. In fact, in total, the Board of Supervisors has allocated over $135 million in County CARES Act funds to provide food support. And there are a number of ways that that money has been spent. One that I want to highlight is a partnership that we launched with the LA Regional Food Bank. And we had discovered early on that a great number of local community food pantries had closed as a result of the pandemic. They were either too small to be able to safely socially distance within the pantry, or the volunteers were no longer available to come work at the pantry because people were staying at home, rightfully so. And so we launched drive-through food events. We've now done more than 90 drive-through food events where anybody, no questions asked, no eligibility requirements, can show up and get 50 pounds of food placed into their trunk. And we were in La Puente earlier this week. We were in Long Beach today. We'll be in Hawthorne tomorrow. We'll be in Southgate. We're going all throughout the county to provide these resources, and as a result, we've distributed more than 9 million pounds of food at these events to about 150,000 households, and so that is one of the ways that we've responded. And we also have a speaker from the food bank that'll talk in a moment. But we've also, as I mentioned, provided our Senior Meals Program. We've provided $20 million in grants to community-based organizations that themselves have stepped up and responded to need that they see in their communities. We've given out 30,000 grocery store gift cards to the most food insecure. We've provided meals, almost 1 million meals for people experiencing homelessness, and the list goes on. And all of these programs, information about them can be had by calling the county's 211 service or going to our website at lacounty.gov. And I'll just wrap by saying, we are absolutely in the county committed to putting food on the tables of our most vulnerable residents. You can't fight a pandemic on an empty stomach, and we want to offer not just food, but hope. So appreciate the opportunity to be here today.
Okay, well, thank you so much, Mr. Gero. I'm sorry, I didn't pronounce your last name right. I can't get it right for some reason. Anyway, let's see. I wanted to acknowledge before we move on that we have interpretation, and I forgot to acknowledge it at the beginning. And we have interpreters for Spanish, Chinese, and Korean. So if you need interpretation, you can go below where it says interpretation. And thank you for the interpreters that do such a hard job. It is a hard job to interpret simultaneously. Mr. Gero, do you have a sense that food insecurity has been growing since the beginning of the pandemic? Has it been stabilized because of your work? But also, is it tied to what we see around the world, where famine and hunger is also increasing due to the pandemic?
Yeah, we saw actually food insecurity spike in April and May of last year. It was at the highest rates, and that was right as a lot of the stay-at-home orders went into effect, and a lot of the businesses were forced to close. Since then, it has come down a fair amount, but not entirely. Prior to the pandemic, there were about 20% of the population regularly suffered from food insecurity. And today, as I said, we're seeing numbers closer to 30%. So it has gone up from pre-pandemic times, but it has been fairly stable. And part of it is, in fact, the response that not just the county, as I mentioned, there are hundreds of community-based organizations that themselves are responding to needs in their communities. The LA Unified School District has stepped up to provide meals. So we're all in this together, providing these resources. And I think they have helped address some of that food insecurity, but also the gradual reopening of the economy, getting people back to work is the most critical thing. We don't have famines in the United States, fortunately, so that's not a source of food insecurity. The primary driver for food insecurity, as I said at the very beginning, was a lack of financial resources. And so when we ask questions around, are you food insecure? We ask, did you eat less than you thought you should because of a lack of money? Or have you skipped a meal or skipped a day of food because of a lack of money? That's always the primary driver of hunger and food insecurity in the Los Angeles County.
What can residents do? What can we all do to help with this situation? Certainly,
the food bank continues to take donations. There have been, some rumors that food banks were not accepting food donations, but they are. They're happy to take as well as your local pantries will take food donations. Of course, financial contributions are always welcomed. That provides the maximum flexibility. And if you, on the county's food website at lacounty.gov, if you go to the food section there, and it's right on the home page, there is a section on how you can provide support. So it's how you can get help on one side. On the other side of the website is how you can actually help and provide support. And you can volunteer at food drives. There's any number of ways that people can get involved.
Great. We're going to move on to the third speaker, but Mr. Jarrow, could you share maybe now or later with us the link to the USC survey on food insecurity?
Be happy to do that.
So the journalists have the data.
Box. Yes.
Okay, cool. All right. Well, thank you very much. And we're going to move to our next speaker, Abraham Gomez. He's the CalFresh program manager at the LA County Department of Public Social Services. Mr. Gomez, please go ahead.
Good afternoon, everyone. I apologize. I've been trying to turn on my camera and it's not working. So I didn't want to crash our system. But as I was introduced, my name is Abraham Gomez. I am a manager for the CalFresh program for the Los Angeles County Department of Public Social Services, which is also known as DPSS. Part of my job is to oversee the implementation of CalFresh policy in Los Angeles County. On behalf of Antonia Jimenez, the director of the Department of Public Social Services, I'd like to take a moment to thank our partners at Ethnic Media Services for coordinating today's briefing, and for all of you for attending today. I think we really appreciate your support in helping us promote these essential programs that can, help people who are currently struggling. So to provide a little information on who we are, DPSS is charged with administering federal, state, and county funded programs for people who may need nutrition benefits, healthcare coverage, and job training. We provide essential services to over 3.5 million people in Los Angeles County. We are the largest public social services agency in the country and the third largest department in the county. We know many families have been hit especially hard by this crisis and are barely getting by. Many families living paycheck to paycheck, even before the pandemic. Today, I will specifically address food insecurity and the benefits of the CalFresh program and how to apply for benefits. So what is the CalFresh program? The CalFresh program, formerly known as food stamps and federally known as the Supplemental Nutrition Assistance Program, or SNAP, is a program that improves the nutrition of people in low-income households by increasing their food buying power so that they are able to purchase sufficient food to meet their household's needs. Hunger impacts all aspects of human life, from healthcare to education. It is therefore very important that we let people know about this program, CalFresh. For many, CalFresh is the first line of defense against food insecurity. As one of the country's most effective anti-poverty programs, CalFresh helps low-income households gain access to healthy food. Families throughout LA County, for the first time ever, are applying for CalFresh benefits to help put food on the table. A record number of people have seen their wages go down due to working fewer hours or losing their jobs. We've seen an increase in people struggling to gain access to affordable food. This is called being food insecure, whereas Mr. Giroux had indicated 1 in 3 households are experiencing food insecurity in LA County. The impact of the pandemic can be seen in the number of CalFresh applications our department has received. For example, in April of 2020, our department received 126,875 applications. That was an 82.3% increase over the previous month, March 2020. In contrast, in April 2019, our department received 45,468 applications. So to put that in perspective, that's a 179% increase in just 1 year. These increases were a result of the state stay-at-home order, which was issued on March 19th, 2020. Last month, we provided services to over 1.3 million people, including 477,000 children. DPSS helped these individuals gain access to nutritious food through CalFresh. Individuals who are potentially eligible to receive CalFresh include US citizens and legal residents, low-income individuals whose monthly income before taxes and other deductions fall under the income limits allowed for their household size. Those income limits are established by the federal government. For example, in a household with 4 people, their gross monthly income must be under $4,368. Resources such as property and money you have in the bank are exempt for most households. To review eligibility requirements for CalFresh, we strongly encourage people to go to our website, and that's dpss.lacounty.gov. We also have a lot of options for people to apply for our services. People do not need to visit our offices. They can apply by calling us at 1-866-613-3777, or they can apply online via getcalfresh.org. And to meet the increased demand in applications, our department has extended our customer service centers. We now have 6 customer service centers. Again, people can call us toll free at 866-613-3777. Our call centers are open Monday through Friday from 7:30 a.m. to 7:30 p.m. and Saturdays from 8 a.m. to 4:30 p.m. Our call centers have highly trained staff who can speak over 10 different languages, including Spanish, Armenian, Chinese, Korean, Tagalog, just to name a few, and they're ready to take your applications. So in addition to CalFresh—
Mr. Gomez, please
yes.
speak a little lower, slower. The interpreters are having trouble because you have so many details in your presentation.
Absolutely. I apologize.
Okay,
I could slow
All
that
right.
down.
Thank you.
In addition to CalFresh, our department administers healthcare services such as Medi-Cal. We also offer cash assistance through CalWorks for families and general relief for individuals. For more information about our programs and services, we strongly encourage to come visit our website, and that's at dpss.lacounty.gov. Is there any information they would like me to repeat? I
Maybe
apologize.
the phone number. Yeah, maybe the phone
Yeah,
number
let
and
me
the website again.
so let me
So we can put it in the chat.
so our customer, I could put it in the chat also, but
Cool. Okay.
our customer call center number is 866-613-3777. And the website to apply online is getcalfresh.org, and I will put a link in the chat for that. And then our call centers are open Monday through Friday from 7:30 a.m. to 7:30 p.m. and on Saturdays from 8 a.m. to 4:30 p.m. We also have information posted on social media. We have all of this information posted on our Twitter, Facebook, Instagram, and YouTube pages. And we appreciate your partnership in making this information available to residents of LA County.
Okay.
So thank you.
All right, great. Thank you. We have a question that I think it's key. We know that there are more people eligible for CalFresh in LA County than are actually enrolled. I personally talked to someone yesterday who, a low-income lady who asked me, should I get, I mean, they're offering me CalFresh, should I get it? I don't know, maybe I'm gonna have trouble with my citizenship. And also someone told me that if I have a house, she owns a house, right, with her husband, but they're very low income and have no job right now, that they're gonna be charged this money later. So there's all of these notions about what can happen if you get CalFresh. Can you explain a little bit about why there's this gap? You think it has to do with this disinformation, or?
I think there's a lot of rumors and misinformation regarding our program, and I really strongly encourage everyone to file an application. For example, we don't count resources typically for eligibility determinations for CalFresh. With regards to do folks have to pay it back? No, they don't. Mm-hmm. That is not accurate.
Yeah, these are notions that are going around.
Right.
And I know we asked the question about immigration status, and we know that CalFresh is only for legal residents and citizens, but also parents of children who are citizens, who may not be citizens themselves, are also eligible, right? Like for
yes.
their children are eligible.
Okay. Their children are eligible, yes.
Okay, and go ahead.
Excuse me. Yeah, I was going to say the Women, Infant, Children program, everyone is eligible, so they don't check documentation status. And that's a critical program for young mothers that I want to point out. And we also, as part of the county's efforts, launched a communications campaign to increase CalFresh enrollment, because you're absolutely right that not everyone who is eligible is signed up, and part of it is just not knowing. And we actually saw a 40% increase from November to January as a result of our media campaign.
Okay, I'm going to take one question from the chat, and then we're going to move on from the next speaker to the next speaker. Mark is asking, what was the number of CalFresh clients more recent than those given for April 2020, 2019? Do you have any more recent stats?
Yes, I do. So
like
for
the
example,
most recent one?
Yeah, so for example, the most recent data that I have is for January. And in January, let me see, we received 64,584 applications.
So they've gone down a little bit.
Our average has actually gone up. Our average used to be around 37,000 applications a month. We're almost averaging about 70,000 now.
No, I was referring to, from the beginning of the pandemic, it has gone down.
Yes.
Okay. You're just comparing it to pre-pandemic.
Pre-pandemic, yes. Mm-hmm.
Okay, great. Okay, so we're going to move on. Thank you so much for.
You're very welcome.
For all of that. And we're going to move on to our next speaker, and that is Elizabeth Cervantes. She's the Director of Agency Relations and Product Acquisitions for the Los Angeles Regional Food Bank. Thank you so much for being with us.
Good afternoon, everyone. Thank you for having me. I was invited to speak today on behalf of the Los Angeles Regional Food Bank because we are on the front lines. We are distributing food directly to people in need in LA County and to our 700 plus agency partners in LA County. So our 700 plus partners are, small pantries, church pantries that distribute food once a month, maybe twice a month, to the larger meal programs that you might see in the Skid Row area. And we are also partnering with new partners such as the county and school districts at this point. When the pandemic hit early in 2020, the supply chain was severely impacted. That was a huge challenge for us because we couldn't get the food that we needed. LA County, the new food security branch, reached out to us, and with their assistance, we were able to purchase foods that Los Angeles persons eat on a regular basis. So, cereal, rice, beans, soup, peanut butter, and much more. The food was given to our agency partners and also distributed at our large collaborative distributions that you may have seen on the news. These distributions take place anywhere between 3 to 4 times per week throughout LA County. Our distributions have increased by 145% compared to pre-pandemic period. The people who receive food are very appreciative of all of our collaborative efforts. There are families who never thought that they would need to receive food from a charitable organization. Some families have 1 or more family members who are out of work. With children attending school remotely, families need additional food to provide meals and snacks throughout the day for these children. A mother and father with 2 children recently stated that they had to move in with a family member. They were in our line because they had both lost their job in the hospitality industry. They didn't have money to contribute for rent to this family member. So they wanted to pick up food as a means to contribution. They had depleted all of their savings and they were still waiting for their unemployment benefits to kick in. We interviewed a senior that was alone in a car. We asked, how many additional food boxes are you requesting? And she said, as many as I can get. I need to take food back to other seniors in my building who are too afraid to go out, who desperately need food or are immobile. In our food lines, we see seniors driving in together to receive food. We also see multi-generational families receiving food. A single mother of 3 was interviewed not too long ago, and she stated that prior to the pandemic, she was living paycheck to paycheck with her 3 girls, and that was okay for her. She said, but she's not even doing that now. Lower income households are the hardest hit because they're struggling now, and they were struggling prior to the pandemic. They are disproportionately impacted, and the majority of those families come from ethnic communities. I've had the privilege to work for the Los Angeles Regional Food Bank for 19 years. I manage our in-kind donations and our agency network. I rarely interacted with food recipients prior to the pandemic, except for visits to agency sites. However, now due to the pandemic, I often receive phone calls from persons seeking food assistance. I remember answering a phone call late one evening during the pandemic, at the height of the pandemic. The woman on the other line told me she was a mother and she had a sick child at home. Her food supply was going to run out within 24 hours. She was upset and crying. I told her, give me your name and your phone number and I'll see how I can get food to you. Her name was very similar to my daughter's first name, and her last name was my daughter's last name. It hit me. And I thought, wow, this could be me or this could be my child. That's why it's important to continue working together to help food insecure persons in LA County. I can share many stories with you about individuals that are food insecure from all parts of LA County. We need your assistance. Many of these stories are available on our website under the stories section. You can read more stories. You can support the food bank in our fight against hunger by volunteering or donating funds at lafoodbank.org. Our collaborations with LA County have helped us so much. We just need to highlight that for everyone involved. And thank you. And please support us by going to our website. Thank you.
Thank you so much, Ms. Cervantes. That was a very moving presentation. Thank you so much for the stories. It's important to have them. I wanted to ask you, who are you seeing in those lines that you were not expected to see? Is there any type of person that's coming up for food that is not your usual person that usually has this need?
So the recently unemployed, the furloughed workers that were impacted in their household, sometimes it's one family member, sometimes it's two family members who are, underemployed or unemployed, who, had, good paying jobs, who, have gone through their savings and are worried about paying rent, paying for medicine and paying for food. That, they really didn't think that they would be in this situation.
Do you have a variety of, go ahead.
Sorry to interrupt. I was just going to add that we have seen, a wide range. Ms. Cervantes is right that we're largely it's affecting the lowest income the most, but you would be surprised at these events that people would call new to need, because they've never had to rely on a government program before. They've always been able to get by. I know we spoke with Unite Here 11, which is the union that represents the hospitality industry workers and the food service workers at sports arenas and other venues. 90% of their membership of their workers have been laid off. And these are people who worked in the food industry, always had access to food, worked good union jobs, and are now in line at these food events to get 50 pounds of food put into their trunks.
Wow. And my next question was, we always talk about the disparities and racial breakdown of, whoever accesses services, the vaccine, this and that. Are we seeing all ethnic groups coming to the food bank and coming to need food, including, those like from the Asian community, for example?
We are serving all ethnic groups. We do see the different communities. So LA County has done a great job on doing data as to where our next distributions, our collaborative distributions should occur. So we are in all the communities.
Okay. All right. So we only have a few minutes left. So I'm going to ask a final question of each of you, and you can add whatever you want to add. And I want to just close with asking if each of you feels that we are moving out of the dark a little bit of COVID of this last year to a more hopeful time. And, what's your biggest hope right now and what's worrying you? So let's start with Dr. Gonzalez.
For that question, Pilar, it's excellent. So our biggest worry right now is the variants and lack of enough vaccine to vaccinate everyone who's eligible as quickly as possible to be able to prevent further creation of variants. So that's one of our biggest concerns. My biggest hope is that individuals will not see this lull or this slight reduction in cases and hospitalizations and deaths as an indication that they can let their guard down. We need to maintain use of all of our measures that we have. You know, for those who can get vaccine, great, get the vaccine, but everyone should be using their mask, continuing physical distancing, not going to big parties or, you know, gatherings, all of the same basic measures, because that's the masking especially is what we know is one of the most effective ways of maintaining the spread of the virus at bay, to being able to help us stop it. So I would say my hope is people continue to wear their masks and take all of the other measures to keep the virus from spreading.
Thank you so much, as always, Dr. Gonzalez. But let's move to Mr. Giroux.
Yeah, thank you for that. And I think our hopes and worries probably mirror those of Dr. Gonzalez, only with regard to the impact of those things on the economy and therefore on people's ability to get food. So of course, our hope is that that the trends continue to improve and that people remain vigilant and people get vaccinated and the variants don't create additional problems, and letting the guard down doesn't create additional problems, because that means we'll be able to open the economy sooner and start to get back to something close to normal. And, you know, it's not going to be a light switch. We're not going to suddenly turn everything on and everyone's going to be back everywhere. But as quickly as we can do so safely, we need to get people working, because they need to have the financial security that comes with a job that allows them to buy the food resources they need.
Thank you so much. And I wanted to ask also Mr. Gomez the same question.
I was able to fix my camera, so that's a good thing.
Oh, you did it. Oh my God.
Yeah, finally. Yes, I think things are going to get better. I think the major thing that concerns me, I'm going to give a CalFresh perspective to that, is that we've potentially identified about 400,000 households in LA County that would potentially qualify for this program, yet have not come in to apply for services. And that could be for a lot of the misinformation that's out there. It could be for a lot of the perceptions, and maybe folks don't even know we exist. Again, we're getting a lot of folks who traditionally will never have come to one of our offices applying for us, and we hope to increase the participation to our program and awareness of our program.
Thank you. Ms. Cervantes?
Yes, you know, hope is the economy will come back, even if it comes back slowly. You know, our mission is still there. We will continue to distribute food, and with partners such as LA County and other donors, we'll continue to be there.
Wonderful. Great. Let's see, we still have 2 minutes. Can we ask another question maybe? Anything else that we left out? Any more comments anyone wants to say? Dr. Eloisa Gonzalez, I was just reading a story about how people who are working in the vaccine lines are feeling this hope and this happiness from people being vaccinated. I love that story, because there's a lot of disinformation about, you know, vaccines. To hear that people have this hope and that they're vaccinating and feeling this happiness. Even the people who are actually putting the vaccines on folks are feeling it. Are you hearing any of that?
I am, yes. And thank you for bringing that up, actually. Yes. So individuals, you know, originally we thought there may be some vaccine hesitancy, that people wouldn't want to get the vaccine, even though it was available to them. And we're actually, thankfully, and very happy to see that. And you see that in what the stories that you're hearing from the people, actually, the vaccinators that are actually working the vaccine sites. I'm very happy that individuals are actually not hesitant to get the vaccine. They actually want it. And that's true across the ethnic groups, with the exception that looks like African-American seniors are not as open to being vaccinated, but Latinos, Asian, all the other ethnic groups are really very open and have basically said, yes, when the vaccine is available to me, I want it. So that is fantastic.
Somebody asked, and I'm going to throw this in because a couple of people asked the question, and I know the answer, but I'm going to ask it anyway. Are journalists getting a vaccine?
Not at this time, unfortunately.
Okay, all right, great. Well, thank you all. We're come to the close of this briefing. Thank you for all your expertise and for answering our questions and being there for the LA County residents. Thank you so much.
Pleasure. Thank you.